Welcome everyone. In this episode, we are going to discuss sedentary behavior, physical activity, and measurement method of those. And we have a great guest for today's episode. She has done her master's degree in human movement sciences in Zhejiang University, China. And she has done her doctoral degree and worked as a postdoc in University of Jyväskylä in Finland. She has also been visiting researcher in University of Southern Denmark, and currently she's finishing her tenure track at Zhejiang University, which is a top 3 university in China. She has published well over 40 papers, mainly focused on sedentary behavior and physical activity. Ladies and gentlemen, please welcome our guest, Dr. Ying Gao. Welcome, Ying. Pleasure to have you. And we have known each other for quite some time, so nice to have a chance also to chat with you. So could you maybe tell, you have been in many places, starting from China, Finland, Denmark, and then back to China. Could you tell a little bit about your scientific journey and your research?
Thank you, Olli. Yeah. Thank you, Olli. Yes, I finished my master degree in Zhejiang University. After that, I very luckily get the Professor Aya Finni's offer for the PhD position. So I traveled about 8 hours flights visiting to Finland, and I still remember the first day I arrived in Finland is the winter time. It's very big snow because the snow is very less at least in my city, Hangzhou. So then I start my almost 7 years research life in Jyväskylä, in Finland. So I completed my PhD degree and postdoc positions. And of course, during my research time, I had some small time to visiting to Denmark to do a visiting research in there, have a small cooperation project in there with the Kisana professor. So nowadays, I returned back to China in 2029 and start my career. It's more like research career in China. So during those years, I think the Finnish research is very impressed me, and I had get a lot friends and nice colleagues. Even nowadays, I still do the collaboration with them, and one of Olli is my previous colleagues, and we are also the friends. So I still remember last time we meet together in Ardo's house. We talk, we drink with coffee, and under the lens talk about how about the future and how we can do the research. Yes. So I think it's very nice experience with you and with others as well.
Yeah. And we had the same supervisor, Taija Finni, who was really good supervisor. So greetings to Taija if you happen to listen. So maybe we can start with your studies in PhD. So what was your PhD about? What kind of studies you did, and maybe tell a little bit about the findings.
Yeah, sure. In my PhD studies, because in that time it's very popular furniture is about sit-stand workstations. Nowadays so many office workers have a so long time sitting in office. So in that study, we under the Taija's supervise, I did my PhD study is related with the intervention of these sit-stand workstations for the housing for the office workers. So in there, we including actually 4 very nice research, and actually finally all of the 4 publications had one publication in the Journal of Sports and Health Science. I think that is currently top 2 journal. Yes, in the sports science. Yeah. So in that PhD studies projects, I I had one study is to compare the Finnish and the Chinese office workers during their daily work time, and to develop the validation of the questionnaire to compare with accelerometers to see how they did in their daily lives for the working time, for the sitting. And then for the second paper, I did the intervention to compare how the office workers, after they get the system workstations, how they think, the work abilities, and how their behaviors changes after 6 months use. So that is intervention studies. And the third part of the study is about the cross-sectional studies. We compare how the people use the system workstation and without those office workers, how their muscle activities during their work time. So we proved, we provide the evidence about when they use stand to in-stand for the sitting during their work, they had the benefits for their muscle activities. So they had less muscle inactivity time and equals more breaks out. And more important, because standing too long time is also not good. But we provide the information is about, we measure with the stadiometers. That is one kind of way to indirect measure the spinal loading for the people. So in that one, we can see after they use this stand workstation to stand for the work, it's not increase there too much for their spine loading. So that is important part. And I think the one excellent study is the last one is we did in a processional over study in the lab setting. We compare them sitting and standing during 2 hours work, how their blood like insulins and glucose regulations and also linked with muscle activities. So that study, we found that the energy expenditure actually during standing had more oxygen fat oxidations to so switching the energy expenditure to carbohydrate to the fat oxidations. So that is the study. I think we start to think about more breaks during your sedentary behaviors. And also this, in our original study, actually, we are using the similar study design. And we also find that using like more frequent and more short breaks, interruptions can benefit the blood glucose during the long time sitting.
Yeah, really interesting studies. So you had one that was validating the questionnaire, doing Finland-China comparison. Then you had the intervention study of sit-stand things, and then you measured the muscle activity and spinal shrinkage in one study, and then insulin responses. So very kind of different kind of studies about sit-stand workstation. So you got the really kind of nice setting of measuring different things. And I didn't remember your study about spinal shrinkage. So you measured how much the spine gets kind of shorter in a way during standing, and it was not important. It was just a small change, and your conclusion was that it's not like bad for the spine. Am I correct? Yeah. All right. And I did also my with Taya my PhD about the muscle activity. So you are using, maybe for listeners, the EMG sorts, which can be used in a convenient way to measure the quadriceps, hamstring, and also maybe gluteus activation. And that's quite nice that you can also measure those. So in your PhD, you were getting a nice setting of how to study sedentary behavior and sit and stand desk. Where did you go in your studies from there?
You mean in China?
Yeah.
Or
Yeah, like what kind of studies you have done after that? You can maybe
okay.
you can pick studies and just tell a little bit about different studies you have made, what you think is
Yeah,
interesting.
okay. Yes, well, before I say this, I have to say a little about during my postdoc search
Yeah,
time.
yeah,
Because
yeah,
in that time, I joined Bias one Chipasi. I call it Chipasi. I don't know is it correct in Finnish way. But anyway, it's the name for the
yeah,
project. So in that time, I measured with for the children. So previous my PhD is for the adults, especially for the office workers. But then during my postdoc, I turned to join that project for the children. So for the children, they are school age children in their daily lives for their sedentary behavior patterns and how target to reduce their sedentary behavior. So follow these lines. I got my first academic of China's research funding. That is supposed me to do my first 3 years research work in China. That project is about the sedentary behavior and physical activity in school-aged children. Objectively measure the sedentary time and associated with muscle activity and inactivity level. So that project actually is very focused on my previous research interests. So it's focused on understanding how children move and sitting during their daily activities. And the most important, we use the combination of the technologies, the textile EMG shots, so to measure their muscle
yeah.
activity. And also I start to use the FIBL research and FIBL accelerometers in my studies to measure with the different intensity of activities and their posture detections for the sitting, standing, moving for those children.
Mm.
So also because I previously collect some data from in Finland, so we are also working on to compare these patterns between Finnish and Chinese children. Yeah.
Yeah.
Because the data collection is quite take time because during 2000, you know, there is about 3 years very difficult to collect data post COVID.
Mm.
So the whole project a little bit postponed. We just last year finished the data collection. Then there's a lot of data analysis. Yes. So about the publication related to this project, we are currently only about the meta-analysis to review papers for the
Yeah.
children about the 24 hours movement behaviors. And there's one paper under review. Actually, it's already the revisions for the CBL validations for the children. Yeah. And do you need me to explain or in details about my projects?
Yeah, I can. Yeah. So in your postdoc, you moved from in your PhD, you were doing the adult studies, and then you started doing more studies about children. And I see you did, for example, study that sedentary threshold for accelerometry based mean amplitude deviation and electromyography amplitude in 7 and 11 years children. So I assume you measured both EMG and accelerometer, and you wanted to find the difference threshold between sitting and standing, that
Yeah.
you could kind of say what's sedentary and what's active. Could you tell maybe just a little bit, like, kind of main idea of this study, that the listeners understand what's
Um,
the how the study was done, and what's the main point of this kind of
okay.
study?
That publication actually is almost 5 or 6 years ago. I published that one.
Yeah,
So
yeah,
I can clearly remember the main purpose because nowadays for the physical activity research, most of the researchers using the accelerometers in their study because that is very commonly to classify the physical activity intensities. But in otherwise, accelerators is only for the accelerations for the movements. Like, so it's not, as we know, the physical activity definition is about muscle contractions. So it's not only about accelerations. So we need more physiology response, at least the information to provide how is the physical activity and sedentary behavior. So in that study, we try to build the threshold to compare. Actually, there's two studies. One is I compare the different cut points using the accelerometers and to compare with EMG threshold for the muscle activity and inactivity. So in that time, we try to provide the ideas is EMG can use one kind of instant or not instant, but some kind of provide more deeper information for the physical activity and sensory behavior. So how really doing different activities, the muscles intensities, and how the muscle activity and inactivity. And then based on the cut points, because the cut points actually there's many disagreement between the researchers. Because different cut points, it means you can get the different results. And it has been proved there's very range for different setting and different cut points choosing. So in my second paper, actually, we try to set up a unique and simple way to measure with the raw accelerations to develop this kind of method. So we found one calculation is for the mean amplitude deviation. So shortly its name is MAD. So that one we can we set up the threshold to how to distinguish between sedentary behavior and non-sedentary behavior. So that is these two papers are what I try to provide and deliver the information.
Yeah, I think it's important. Many times when we are measuring with acceleration, we kind of forget that what activity actually is. And some people might think it from the cardiovascular response, that if the heart rate goes up, that's activity. But basically it's first the muscle activity which is causing the heart rate to go up. And then you can have muscle activity which can be isometric. And if it's isometric, then you won't see any movement or acceleration. So the accelerometer won't detect the isometric. Of course, if you have the device on the thigh, then you can detect that the person is standing. So there needs to be some isometric activation in the body that you can support your body. But it's interesting that how is the whole picture. And then when the muscle activity is dynamic, then you are actually moving, and then you can detect something with the accelerometer. But it's nice that you are kind of combining it and measuring the acceleration. So I think it's very interesting studies, and a little bit from a different perspective. I think it's very much needed.